So there are a number of aspects that occupational therapists would be highly involved with. So we talked a little bit about the sort of sensory integration program and building up a picture in order to set something up for that. There's also the sort of postural management and spasticity management and seating. So it's all in combination. So looking at how we can reduce posturing and reduce any sort of spasticity, and making sure that people do not get contractures or minimise them, and trying to support people to sit out, so that again it's good from a postural point of view, it's good for an assessment of awareness point of view, but it can also be very good for an engagement point of view with and being able to go out with families and return to some enjoyable activities, particularly if they're in a kind of minimally conscious state where it's more likely to be able to demonstrate that they can enjoy some of those activities.
So would it be fair to say that posture and seating is absolutely central?
Yes.
To cdoc care?
Absolutely, and it's one of the very first things that we do. We work very closely with the physiotherapists in looking at that, analysing postures and positioning, both in bed and in the chair. It's very important. And then we would also be looking at the plan for where they go to from us, and it could be a nursing home or it could be home. One of the key things is looking at what is in their best interests. So actually, is it in their best interest because they may have a trachea, or they may have a lot of postural issues or spasticity management issues? Actually, is it in their best interest to go to a specialist nursing home that can manage their needs? And for some people who maybe have more awareness, it might be very appropriate for them to go home and be with their family. But we do try and look at that very closely, because we don't want family to feel obligated sometimes, and there are definitely sort of cultural biases, and sometimes a family, there's a family member that's expected to look after their loved one regardless of whether they are able to. We consider how many family members are around and can support, because we know that it's not always just about carers coming in. It needs to be much more than that. But we have had some people go home who have done very well, because they have the whole family around them, and they're just constantly supported by different family members. But the amount of work that takes is enormous, because we need to go out and obviously assess the home and see if it's suitable. We need to consider with the family members whether or not they can consider to manage their needs. Often we will have to carry out a lot of training, and the nurses are highly involved with that, as the team involved with a whole range of activities to support them. We have to carry out our risk assessments. We've got to be clear that it is in the patient's best interest